Hello, my beautiful people. It's your girl Delia Amy once again. Thank you so much for clicking. If you just delivered and have elevated temperature, know that you have postpartum or after birth fever. In most cases, a mild postpartum fever goes away on its own, but sometimes it could be an indication of a more serious condition. So a postpartum fever should not be ignored. Get medical treatment right away. If you have the following additional symptoms together with the fever. So if you have a fever that is higher than 38 degrees Celsius, please do well to inform your doctor. And if you have like a fever and leg pain, you have pains and swollen legs, please contact your doctor immediately. If you also have pain on your stomach, okay, that came out. So if you have that fever and stomach pain, please don't take it lightly. Inform a doctor right away. Also, if you have vaginal bleeding, it's normal to have vaginal bleeding after delivery, whether C-section or normal delivery. It's very normal to have vaginal bleeding. But if the bleeding is so heavy, okay, that it fills your pad like in a very short period of time, you should please inform your doctor. Okay, so vaginal bleeding that is very that is heavy, and also you should take note of clots. If you have large clots, please inform your doctor. Also take note of pulse at an incision site, like if you had a cut during a normal delivery or a C-section. You should also take note of pain on the right side of your abdomen, especially after a C-section. Sorry, the left side of your abdomen, which is where I think the uterus is being situated. Please take note of that. If you have that pain, inform your doctor right away. Pain when going to the toilet. So I had this experience too, like I just had my baby and I had the baby through a C-section, okay. After I got discharged, I had a fever, and with the fever, I had pain on my left side. Okay, I had my abdomen was very sensitive to the point that if you just pass your hand on my abdomen, I would feel that pain. Okay, and then when I go to the toilet to pee, whatever way you call it, to urinate, I have severe pain, like something is heavy is coming out of my vagina. Okay, so I had these symptoms, and they were actually a sign that I had a severe condition. I had an infection. Yes, that was an indication that I had an infection, which led me to another operation, like within a period, I think 7 days after the C-section. So if you have any of these symptoms, please don't just consider it to be something normal. From the moment you even have a fever, inform your doctor. Then when it combines with pain, okay, and excess bleeding, please don't stay at home, because the longer you stay at home, the more complicated it becomes. These symptoms are usually an indication of an infection, especially for someone who had a C-section. It could be an indication of infection such as endometritis. It could be infection like urinary tract infection, okay, UTI, urinary tract infection, mastitis. Sorry, I cannot pronounce this one well. Mastitis is infection in your breast, okay, that your breast has it could be an indication that your breast has an infection. So please do well to inform your doctor, because conditions such as endometritis are actually life-threatening conditions that requires a surgery, requires another operation. Also, you have another deadly infection, which is also the symptoms also are like you have this fever, okay, especially fever, chills, which is sepsis. Sepsis is as a result of when you contract a bacteria called Staphylococcus aureus. Okay, this bacteria stays on your skin. It's on the human skin, it's on the human skin, and it usually leads to like food poisoning, or it can It causes boils and abscesses. It is not very harmful when it's on your skin, but when it gets to your bloodstream, it becomes very dangerous. It leads to sepsis, and it can go to your heart and damage your heart and damage your brain, which can really take you to intensive care unit and possibly death. Okay, and with infections like this, you need antibiotics that are being administered like through a needle, and you will need to stay at the hospital for a period of time to receive all these antibiotics in order to be safe. So please take note that you should never ignore postpartum fever, whether you are the one or you are a guardian to someone who just put to birth, or you are a neighbor, a friend. If you have anyone with fever after delivery, take it seriously. This has cost a lot of lives, especially in Africa. Okay, especially in Africa, because I remember for us, in my language, we call it after birth, like after birth pain. Okay, because after delivery your body needs to heal. Sometimes it can give you that mild fever because of the hormones and all those things. It can cause a fever. Also, you can have like for people with cuts. Okay, if you had a cut during a normal delivery, the stitches and all those things can give you that fever. You may have swollen feet. Okay, which can also give you a mild fever, and that fever will go away. But if this fever is an indication of a more serious condition, which is usually ignored, we've had a lot of cases we've had a lot of cases where a woman put to bed, after 3 days the woman dies, or after 1 week the woman dies. You hear of cases where they even go, like, they're about to operate the woman again, and then the woman dies in the process because they have delayed. When you had the fever, you were like, okay, it will go away, it will go away. You were taking paracetamol, you were taking any other fever medicine. Like, when I said I had a fever, I told a friend who is a nurse in my country, and she was like, oh, maybe you have malaria. I said, no, we don't have malaria here because we don't have the mosquito that gives malaria out here. So I don't think I have malaria. And that is usually the case. Okay, if someone says he has a fever, they will tell you, oh, you have maybe malaria, or it's just a fever, just take paracetamol and it will go away. And I almost also had a very serious condition, because when I had this fever, I left the hospital 5 days after my C-section. I got home that same day I started having the fever. It was on a Friday, Saturday, and Sunday. I had the fever. Monday, I went to the hospital. The doctors were like, okay, we could administer antibiotics to see maybe it can help to solve the problem. And as they were delaying on Monday, Tuesday, Wednesday, Thursday, my condition got worse, that I had a severe fever. I thought I was even giving up, until they had to rush. They took me, like, they were rushing with me to the theater, and then they had another operation. I was fortunate it didn't get that bad that it led to something more dangerous. So please take note. Don't ignore postpartum fever. If you have it, contact a doctor immediately, and make sure that you look out for other symptoms like the symptoms I mentioned, and tell your doctor every single way that you feel, so that they can handle the situation immediately and try to solve it so it doesn't get more complicated. So thank you so much for watching this far. Please remember to subscribe, remember to like, and please don't forget to share this video. Drop a comment, ask any question, and I'll be ready to answer the questions. And don't forget to share this content, okay? Please share it. It can save a life, it can save a friend, it can save a neighbor. Thank you so much. Bye bye.